Hi, I'm Maria Sepulveda, currently in a nursing master's program in holistic health at Florida Atlantic University. Today, I will share with you an evidence-based project called Zen Shift. This is the nursing situation that we identified for our project called Zen Shift. During my first semester, I spent a lot of time rounding and listening to the nurses on high acuity floors, both bedsides and charge nurses. I created a survey to really capture their voices, asking about their job satisfaction, their workload, their emotional well being, and how their shifts were affected. What came back wasn't just numbers, it was a strong and painful message. Nurses, especially first year nurses and charge nurses, were carrying heavy emotional loads, long shifts, overwhelming patient demands, and emotional exhaustion were taking a serious toll on them. Their stories resonated deeply with me because I had lived the same exhaustion myself during my years as a CVOR nurse. I understood firsthand how heavy the emotional burden can become when we're constantly giving and rarely refilling our own well. This shared experience revealed something important, a true call for nursing, not just to recognize the stress, but to do something about it. The proposed solution. SendShift was co-created with input from charge nurses and floor nurses after gathering feedback on stressors, emotional strain, and wellness needs. Offer stress relieving tools were one of the things that we looked at, like aromatherapy, nasal inhalers. We talked about lavender, bergamot, and peppermint specifically, and sound guided meditation to be available in our existing Zenden. How do we provide easy access for these nurses? Well, we wanted to make something that we didn't need to have appointments, that nurses could use these tools during breaks and they were easily accessible. You can come in and out as needed. How can we support them emotionally recharge was another question. And we came up with something that could promote mental clarity, emotional balance, and greater job satisfaction. Patient population and health needs analysis. The project focused on bedside and charge nurses working in an acute care setting, nurses caring for critical ill patients on high acuity floors. Most of the staff were women, ranging in age from early 20s to mid 40s, with a mix of newer and more experienced nurses. Through our surveys and conversations that we had, we realized that some of the most valuable groups were the first year nurses that just started their careers, and the charge nurses who carried for a big weight of managing entire units under an intense pressure. The most common health needs that surfaced while we were rounding and having these conversations were high stress levels, emotional exhaustion, and early signs of burnout. Research supports what we were seeing firsthand. Studies show that high workloads, long shifts, and emotional labor for nursing significantly contribute to burnout and job dissatisfaction. Shaw and Moss, 2021 and 2016. Although resources like employee assistance programs technically exist, many of the nurses either didn't know about them or didn't feel comfortable using them. Sometimes they expressed that they were too complicated to access. What website or what do I have to do? And it seemed like it was super demanding in the middle of their hectic work shift. It became clear that there was a real gap. Nurses needed something simple, immediate, and supported right where they were, not another complicated program to figure out later. Patient population and health need analysis. As we continued exploring the needs of our nurses, we realized that there were challenges that they faced weren't just about individual stress. They were also rooted in bigger system issues. Extended shifts, heavy workloads, unpredictable schedules depending on the floor that they worked, and even the stigma around asking for emotional support were all barriers that nurses face daily. Literature shows that these organizational barriers contribute directly to high turnover rates and emotional distress among nurses. Kelly, 2021. We looked at national goals like Healthy People 2030. It was clear that our focus aligned closely with two important objectives. Well, the first one was workplace health promotion and improving mental health and reducing mental disorders. The key studies also reflected that what we were seeing already. 31.5% of nurses today experience burnout, Shaw 2021. Over half of our critical care nurses reported emotional exhaustion, Moss 2016. High workloads and long shifts are linked to a 37% increase in nurse turnover, Kelly 2021. And burnout costs hospitals about $9 billion every year, NSI Nursing Solutions 2022. All of these numbers made something very, very clear. Addressing emotional wellness isn't just about feeling better. It's critical for retaining nurses, protecting patient care, and keeping healthcare systems strong. And it starts by recognizing emotional well-being as a real and urgent health priority for our nurses. Organizational effectiveness and nursing care delivery system analysis. This is a trauma hospital located in Miami, licensed for 467 beds, staffed with approximately a 6-to-1 nurse to patient ratio, depending really on the acuity of the floor, right? We follow a primary nursing model where nurses are responsible for coordinating care directly with their assigned patients. Bedside nurses, charge nurses, and interdisciplinary teams work closely together to ensure patient needs are met. The staffing is flexible based on acuity and census, and leadership monitors performance through turnover rates, patient satisfaction scores, and staff engagement surveys. Overall, the system is designed to prioritize high-quality clinical outcomes. However, emotional wellness support for nurses during these shifts is not formally structured yet, which became clear through the survey results. Organizational effectiveness and nursing care delivery system analysis continued. Our nursing leadership is supportive. They help with programs like Kamatua to teach first-year nurses skills and offer mentorship with more seasoned nurses. When nurses have critical concerns, leadership ethic committees work together to help. But even with these programs, the survey showed that nurses are still feeling a lot of stress, emotional exhaustion, and burnout. The programs have mostly focused on clinical skills, how to take care of patients, and someone to lean on in times that you need it or difficult situations. But they don't really teach us how to take care of ourselves. In nursing school, we learn how to treat patients, but not really are taught how to manage the emotional and mental stress that comes with the job. This is something many jobs deal with. But in nursing, it's even bigger because we give our body, our mind, our heart every day to our patients. That is why we co-created ZenShift. To give simple ways to care for their emotional needs, nurses can now look into getting a little relief during their shifts and utilizing tools we can use throughout our whole career. Literature review, holistic modalities for stress reduction synthesis. To find ways to reduce stress in nurses, I reviewed 3 research articles. The first article was by Alamed, and it talked about 5 micro practices to reduce stress. The purpose of this was to evaluate simple mindfulness-based micro practices to reduce stress among nurses. What they did was they used these micro practices like breathing, exercises, and gratitude reflection to reduce their stress. Their methods were integrative review and pilot studies in clinical settings. The only critique was that although this was promising, but a larger randomized trials were needed. The second article was about brief mindfulness practices for healthcare providers by Gil Martin. The purpose was to review a short mindfulness intervention for healthcare workers' stress. The methods were systematically literature review. The results were brief practice like body scan and breathing reduced emotional exhaustion and stress. The critique was variability in methods and small sample sizes across the study itself. Literature review continued. The third article was about brief mindfulness practices for healthcare workers. Gil Martin. The purpose is to systematically review the effects of brief mindfulness interventions on healthcare providers' stress. The methods were to review multiple studies across healthcare professions. The results were brief mindfulness practices effectively reduce emotional exhaustion and improved well-being. The critique for this article was the variability and intervention and methods and populations that were reviewed. Overall, the synthesis findings for these were all 3 articles support using brief mindfulness-based interventions for stress reduction in nurses. The limitations included like small sample sizes and differences in program types and follow-up periods. But overall, all of this evidence supports integrating mindfulness practices into healthcare environments. This can promote wellness. The Peacock question guided the evidence search and development of the ZenShift project. I focused on nurses working with high stress environments and explored whether implementing self-care and wellness education compared to providing no education would help reduce stress levels over a 4-week period. This question helped shape the literature review, project planning, and outcome evaluation. ZenShift implementation. The ZenShift project was developed and implemented following the 7 steps of evidence-based practice. When nurses entered the Zen room, they were immediately welcomed by a calm and peaceful environment. Right at the center or the entrance, there was a QR code that invited them to quickly complete a short survey about their current stress level, in which you could see in the picture to the left. After completing the surveys, I offered them a personal aromatherapy nasal inhaler. They could choose from lavender, peppermint, or bergamot. They can choose all 3 or 1, whichever one they wanted. This was along with a small pamphlet that explained the evidence behind how each scent could help reduce stress, safety instructions and how to use it, and QR codes on the back linking to the research articles in the case they wanted to read them. As they moved deeper into the space, they found different seating options. Comfortable massage chairs facing a large 55-inch TV and additional relaxing areas throughout the room. We had soft landscapes of nature scenes playing on that 55-inch TV across that screen and another one that was facing the other sitting areas. This was a 5-minute body scan meditation that was guiding them gently, followed by a 5 minutes of therapeutic music in between. The meditation and music were looped continuously, so they can come and go as they pleased, and they can stay for another one if they wanted, or if they only had about 5 minutes or 6 minutes, they could just join that. This created an atmosphere where nurses could take just a few minutes for themselves to breathe, relax, and reset during their busy shifts. Before leaving, they were invited to complete a final short survey to capture how they felt after the Zen shift experience. This process allowed the nurses to experience a full circle of care, from intentionally pausing to assess their stress, to engaging with mindfulness, aromatherapy, and finally reflecting how even a few minutes of self-care could shift their emotional well-being. Zen shift implementation. The Zen shift activities were made available at different times of a day, some mornings, some afternoons, on different days during the week, for about 4 weeks. This gave the nurses the flexibility to participate whenever their schedules allowed. Some came in during short breaks, while others stayed a little longer when their units allowed. The goal was to offer an open, welcoming space that nurses could step into without pressure, a place where even a few minutes of mindfulness and deep breathing could make a difference. Naturally, there were some barriers. We had, on particular busy days, many nurses found it to be difficult to come down and take a break away from their patient assignments. Even a few minutes of their constraints remain on bigger challenges, right? Like especially during peak hours where we had a lot of patients coming in and out of the hospital. However, the opportunity to recharge even briefly was deeply appreciated by those who participated. I even had a lot of nurses ask me when was the next Zen shift, and were looking forward to it because they heard from other nurses on how great they felt afterward. This project aligns strongly with Healthy People 2030 goals, specifically the focus on promoting emotional well-being and mental health among healthcare professionals. The Zen shift experience wasn't just about stress relief, it's also about co-creating a culture where caring for nurses' mental health is seen as just as important as caring for our patients. To measure the impact, we compare the pre and post survey stress levels, looking for trends in how nurses felt before and after engaging in this Zen shift room. We also collected qualitative feedback, with many nurses expressing that simple opportunity to slow down, breathe, and be surrounded by peaceful visuals made a meaningful difference in their day. Looking ahead, there is a strong potential to expand Zen Shift program hospital-wide, making it a regular part of a workplace culture. For future plans, this could include offering routine wellness breaks, integrated holistic support to our new nursing organization, and continuing to create spaces that remind our caregivers that healing matters too. This could also be extended to our sisters hospitals and much more. Quantitative results, pre-stress levels. Before nurses enter the Zen shift room, we ask them to complete a brief pre-survey using a QR code. We kept it very simple, just 3 questions. First, we asked on a scale of 1 to 10, 1 being the least amount of stress and 10 being the highest amount of stress. How would you rate your current stress level right now? Then, what is your usual go-to practice when you feel stressed? And finally, what inspired you to try Zen Shift today? 71 nurses participated. What we saw in the answers was powerful. 73% of them rated their stress level at 6 or higher before entering Zen Shift. The word clouds you see below captures some of the coping tools that mentioned in question 2. The popular ones were sleep, breathe, rest, listen to music. But it was clear that many didn't have a structure or an easy accessible way to manage their stress during a busy shift. For question 3, what inspired you to try Zen Shift? The answers, as you see them at the bottom, were to relax, I'm curious, I want a mental break, I want a chair massage. These pre-survey results confirm that we sensed the whole time during rounding. Nurses were carrying a heavy emotional burden every day, and they were ready for something, even something small, that could offer a real relief. Quantitative results post-stress levels. After participating in the Zen Shift experience, we asked the nurses to complete a brief post-survey before leaving the room. Again, we kept it very simple. We asked them to rate their current stress level now after their experience. Again, on a scale 1 to 10, 1 being the least amount of stress versus 10 being the highest amount of stress. How would you rate your stress level after your experience today? And we asked, what did you like best about your experience today? The shift in numbers was striking. 96% of nurses rated their stress as 3 or lower after participating. More specifically, 11% rated their stress as 0, meaning no stress at all in that moment. 44% rated it at 2, 41% rated it at 3, and only a small handful rated it at 4. When we looked at the open-ended feedback, a common theme emerged. You can see it on the little cloud in the bottom, which were captured here in the word cloud, right? Words like relax, calm, meditation, and I feel came up again and again. Nurses share that even a few minutes of breathing, resting, and being immersed in a peaceful space made a real difference. This feedback confirmed that emotional wellness support doesn't always have to be complicated. Sometimes it's about creating a small, intentional space where people can reconnect with themselves even during the busiest of shifts. They really liked the nasal inhalers because they can keep them in their pockets, and throughout their small conversations in their way out, they were very thankful, and they were going to try to use the nasal inhalers and what they learned during the small time they were in Zen Shift. Introduction to Theory U. What is Theory U? Theory U is a framework that guides transformational change. It helps groups move from old reactive patterns into deeper place of awareness, allowing true innovation to emerge. Theory U is a powerful guide for transformation. It isn't just about a quick fix, it's about a journey, one that can lead us from simply observing problems to co-creating solutions that truly matter. This journey follows 5 important key movements. First is co-initiating. beginning by building trust and coming together with a shared purpose, lighting the spark of intention. Co-sensing is together we can step back to deeply observe and listen, not just to each other, but to the larger system that we're part of. Pre-sensing, in the quiet moments, we can connect with our inner wisdom and uncover profound insights about what truly matters. Co-creating, with fresh ideas and newfound clarity, we can roll up our sleeves to test and shape innovative solutions as a team. And co-evolving, the seeds of collaboration begin to grow, spreading successful ideas to create lasting impact. The purpose is to help leaders and teams of people to shift from reacting to challenges with old habits towards creating new, innovative, sustainable solutions through deeper awareness, reflection, and collaborative action. Um, in the Zen Shift project, Theory U helped us guide us from recognizing stress as a problem to co-creating a healthy intervention that was rooted in real needs and insights. Introduction to Melnick's 7-step evidence-based project model, or EBP. Melnick's EBP model is a clear and structured way to bring evidence into clinical settings. It's made out of 7 steps that guide you from asking the right questions to making real, impactful changes. It starts by encouraging a spirit of curiosity, questioning how things can improve. Then you focus on those questions using the PCOT format, which helps structure them clearly. Next, you search for the best evidence available and critically review it to ensure it's both reliable and relevant. From there, you put that evidence into action in practice. Then evaluate the results to see if it makes a difference. Lastly, you share what you've learned so others can benefit and build on those successes. For Zen Shift, this approach gave a clear guide to tackle the nurse's stress, starting with identifying the issue, creating and testing solutions, and evaluating their impact. Integration of Theory U and Melnick's EBP model. In this project, we use both Theory U and Melnick's 7-step EBP model to guide our work. We started with co-initiating, where we listened carefully to nurses through surveys and conversations and recognized that stress was a real and shared concern. Then, during co-sensing, we went deeper. We listened not just to numbers, but to the feelings behind them. We shaped our PCOT question based on what the nurses were truly experiencing and searched for holistic practices that could meet those needs. In pre-sensing, we paused and reflected, not just on the evidence, but on what we felt was right. We connected to a deeper sense of what interventions would truly help nurses heal and recharge emotionally. Co-creating happened through real collaboration. We worked together with charge nurses and bedside nurses, meeting and designing the Zen Shift intervention to bring calming practices like aromatherapy and body scan meditation into the hospital setting. Finally, and co-evolving, we gathered both the numbers and the real words from the nurses. We reflected on the impact the program had, and we planned how to share these results and expand wellness initiatives moving forward. Both frameworks helped keep the project connected, not just to evidence, but to the real human needs of the nurses we were hoping to support. Co-initiating and Melnick step 1. How do these work together? While rounding in different floors and through casual conversation with nurses, I observed a consistent theme. Bedside nurses and charge nurses were feeling emotionally drained, overwhelmed, and highly stressed. These real-world observations were later confirmed through pre-surveys, which showed that stress levels were specifically high among first-year and charge nurses. Although technical training, clinical education programs like Kamatua are available, there was a clear gap in emotional and mental wellness support during shifts. Recognizing this urgent need became the driving force behind my evidence-based project. Finding a way to create an accessible, simple solution to help nurses decompress, recharge, and feel emotionally supported at work. Co-sensing in steps 2 and 3. Population and health needs. Our project focused on the acute care and trauma nurses working in specialized units. These nurses manage very sick patients, frequent emergencies, and rapid patient turnover, often under intense emotional and physical pressure. Through rounding, conversations, and surveys, I learned that emotional resilience, stress management, and support for trauma exposure were major needs. The main barriers were long hours, heavy patient loads, and limited structured emotional support during the day. We aligned these findings with the Healthy People 2030 goal of promoting mental health and emotional well-being among healthcare workers. First-year nurses and charge nurses balancing clinical and operational demands were especially vulnerable. Based on all of this, the creation of our Peacock question was born, focusing on a simple evidence-based wellness intervention that could help lower nurses' stress during their shifts. The Peacock question is, in nurses working in acute care hospital settings, how does participating in Zen Shift wellness intervention, aromatherapy, body scan meditation, and therapeutic environment compare to baseline stress levels that affect self-reported perceived stress after 4 weeks? Co-sensing, step 3. During the co-sensing phase, we weren't trying to build anything yet. We were focused only on understanding what was happening, first with the nurses and then with leadership. After collecting survey results and hearing nurses' stories, I shared these findings with my CNO and other leaders. They listened. They acknowledged the stress and emotional exhaustion nurses were facing. They were supportive and open to new ideas, but at the time, there weren't any formal emotional wellness programs available during these shifts. This conversation was part of sensing the energy of the organization, recognizing that while leadership cared, there was a clear space for something new to grow. Pre-sensing, step 4, the literature review and evidence synthesis. After sensing the emotional needs of the nurses and the openness of leadership, we paused to reflect and deepen understanding. We researched the best available evidence to find holistic interventions that were simple, practical, and supported by research. These articles we chose showed that the mind-body techniques like body scan meditation could lower stress quickly and meaningfully, even during busy shifts. The literature also supported the idea that small, accessible practices like aromatherapy could offer stress relief without disrupting workflows. These findings confirmed that we had what we had sensed, that nurses needed something easy, comforting, and immediate to help manage their stress at work. The evidence guided the design of the Zen Shift intervention, blending body scan meditation, therapeutic environment, and aromatherapy into simple experience nurses could access during their shifts. Final peacock question. Pre-sensing step 4. The peacock question was, in nurses working in an acute care hospital setting, how does participating in a Zen shift wellness intervention, aromatherapy, body scan meditation, and therapeutic environment compare to baseline stress that affects self-reported perceived stress after 4 weeks? After listening to the nurses sensing the needs of the organization and reviewing the best available evidence, we finalized our peacock question. We focused it specifically on real goals to see if participating in Zen shift wellness intervention, which included aromatherapy, body scan meditation, and calming environment, would help lower nurses' self-reported stress levels compared to their baseline levels. This peacock question guided every decision that followed, from the design of the intervention and how we measure success. Project plan, co-creating, step 5. When we shared the results of what we heard from the nurses with leadership, there was no debate. It was clear something needed to change. Together, we co-created a healing experience inside the Zen room, using the real needs and feelings we had to sense during rounding and conversations. Everything was designed to feel simple, safe, and welcoming. A space where nurses could take a deep breath and find a moment of peace in the middle of chaos. This wasn't about teaching more skills or asking from them. It was about offering restoration. We made it easy. A quick survey when they entered, a choice of comforting aromatherapy, a gentle meditation with calming nurture scenes and quiet music to soften the energy of the space. Zen Shift was built as an offering of kindness, a small but powerful offer. Outcomes, co-creating, step 6. The number alone showed that stress dropped dramatically after nurses experienced Zen Shift. But what mattered even more were their words. It's what they said. Nurses told us that they felt seen. They felt lighter. Some said that it was the first time in weeks they had a moment to truly breathe. Zen Shift wasn't just a program. It became a small act of love within the hospital walls. It reminded nurses that their well-being matters too. Sharing the results, co-evolving, step 7. After gathering our evaluation results, we share the impact of Zen Shift with leadership, nursing educators, and directors. These conversations weren't just about numbers. They were about emotions and energy we saw shift in our nurses. Even before formal presentations, something beautiful happened. Nurses who had experienced Zen Shift started sharing their stories with others. The word spread naturally, building interest, curiosity, and new conversations about emotional wellness on the units. Going forward, we plan to formally present the results at other facility leadership meetings and hope to expand Zen Shift to other sister facilities. Sharing the results isn't just about reporting what happened. It's about nurturing a larger cultural shift where emotional well-being is valued just as much as clinical skills. It's about keeping the heart of healing alive inside of the walls where nurses give so much every day. Hi, I wanted to share one of the pamphlets I made for the aromatherapy and Zen Shift. This one in particular is bergamot and is specific for nurse stress relief. At the beginning of the trifold pamphlet, you can see a little blip on what nurse stress relief is with bergamot. When you open it, you can see how does bergamot help and the recent things that it could help with, and also the studies. I usually put 3 in each pamphlet so they can have information on how it actually does work. A lot of these are work related for specifically physicians or patients or nursing. Um, Also, in the back, there were safety considerations, specifically to avoid ingestion or allergies, or if there were any medical conditions or medication interactions that were contraindicated for with the specific scent. And finally, there were 3 QR codes for the studies. If any of the nurses were interested or curious on reading the whole entire study, they could find it easily. My personal reflection on what I learned in this project. Well, this project became so much more than what I expected when I started. I thought I was building a wellness intervention, but what I was really building was a way to listen, to care, and to connect to people with themselves. I learned that evidence matters, but so does presence. Healing doesn't start with an intervention. Healing starts when someone feels seen, heard, and cared for. Moving forward, I want to keep creating spaces where nurses and patients feel safe, not just physically, but emotionally and spiritually too. Theory U taught me to trust the process of sensing, pausing, and creating together. Melnick's EBP model taught me how to build real lasting change with strong evidence. But the heart of this project and the heart of my future practice will always be this: leading with knowledge, yes, but always leading with an open heart. These are my references, and I want to thank you for listening to my evidence-based practice Send Shift project.